Good afternoon, everyone. My name is Judy Blake, and I am a program coordinator for Family to Family Network. We are in Houston, Texas, and we serve families in the greater Houston area. Thank you so much for joining us today. We're going to talk about the Medicaid waivers and making sense of the Medicaid waiver system. There is a lot of information to cover, so some of the slides we are just going to breeze through. We will be able to send you the recording link if you would like it. You just need to email me and let me know. I'm the one who's been sending you the email reminders. So please feel free to email me and I'm happy to send you the recording probably sometime tomorrow. So we're going to go ahead and get started. So we just need to know, can you all see the poll screen? Leslie, can you see the poll
Yes,
screen?
yes, I
Okay,
can.
Yes,
great.
it's there. Mhm.
So because we have people from all over the state who have registered and we're not sure who's on, because we're not sure where you're from, we just want to know if you could type in the chat box, what do you know about the Medicaid waivers? Number one, nothing. That's why you're here, and that's okay. We like nothing in this case. Number two, you've heard of them, but you really don't know what they are, and that's okay too. Some of you may know a lot about the waivers, and for some of you, you may know children or your child is on the waiver. So if you could just type in the chat box, that would be great. So we have an idea of who is of the level. Okay. Thank you so much, Anna.
And if your child is on a waiver, let us know which one.
Okay. Yes, and MDCP. Thank you, Vivian. Thank you, Kelly. And perfect. Sounds great. So we have a little bit of everything, which is really great. We love that. So hopefully we can have something for everyone. Feel free to type your questions in the chat box. If you don't feel comfortable asking questions, feel free to private message myself or Leslie, and we'll take questions at the end. So please know, Leslie, who is my wonderful colleague, we also have Leonella and Christina. We are not employed by Health and Human Services. We work for Family to Family Network. I call us Tiny But Mighty, and we are a nonprofit in the greater Houston area. If you need to verify information, please do so. And we have listed the Health and Human Services website, and we encourage you to do that. So let's go ahead and get started. So it's really important. All of you, hopefully on this call, understand the importance of special education and receiving special education services. So one of the things that we always say at Family to Family Network is that your child, they're not a SPED student, they are receiving special education services. And the purpose of those services is to prepare students for further education, employment, and independent living. We want our kids to be college ready and career ready to the extent possible. And that can be different things for different students and for different people. But the point is that you always want to have a goal in place and have that vision for your child, your student, your loved one. It's important to remember that adult services are not guaranteed. You must qualify for them. Most adult services are not free. The only exceptions to that would be the Texas Workforce Commission, called TWC, or if you have a Medicaid waiver. So, as you know, being in the school district, dealing with ARD meetings, We love our abbreviations, our acronyms, and here are several of the uh, abbreviations that we're going to be discussing today. So LIDA, that is what we call your local authority, and that stands for Local Intellectual and Developmental Disabilities Authority. Keep in mind, if you're in another part of Texas, your local authority might be called something like Tri-County Behavioral Health. If you're in Harris County, it's called the Harris Center. If you are in Fort Bend County, it would be Texana. Unfortunately, some of the what we call LIDAs still use ancient terms that really are outdated and should be changed but haven't been. And what I'm referring to is LIDAs or local authorities that use the term MHMR. That's something that we don't use anymore, but some LIDAs have not changed their name, unfortunately. ICF IDD stands for Intermediate Care Facility for Persons with Intellectual and Developmental Disabilities. So I'm not going to read each one of these. We just want you to be aware of these different abbreviations as we go through, and they will be we will be letting you know again what they mean on each slide. But this just gives you an idea of all of what we're going to be discussing, and those acronyms are on that page. So a lot of people get really confused because they say, oh yes, my child has Medicaid, like that's a waiver. That's different, and that's Medicaid for health insurance. So what we're going to talk about today are the Medicaid waivers. There are several waivers that we're going to be discussing. Your child may qualify for one or two of them, may qualify for a few of them. It just depends on the disabilities that your child has. But we are talking about waivers. If your child is on Medicaid for health insurance, you might have United, WellPoint, Texas Children's Health Plan, but the difference in the Medicaid insurance, there's Star Kids, Star Health. There's the CHIP program, which stands for Children's Health Insurance Program. So I just want to make sure at the very beginning that you understand that having Medicaid health insurance is different than having a Medicaid waiver. Whoops. Whoops, I did not mean to do that. Let me go to the next slide. There we go. So why do we call them waivers? We call them waivers because what our government is allowing us to do is waive those Medicaid rules so that there are different delivery options. The goal is to keep our loved ones out of institutions, out of nursing facilities, out of, to the extent possible, state-supported living centers. The goal is to keep people in the community, keep them integrated using natural supports, community supports. And the reason we call them waivers is because it is waiving those Medicaid requirements, those rules. So on the left-hand side, you'll see nursing facilities. And on the right-hand side, you'll see examples of intermediate care facilities or the state-supported living center. Please note that these are just examples. It's not as though we are endorsing any of the facilities listed on this page. These are just examples of places that your loved one could go to. We certainly have relationships with these agencies. These are just examples that we picked to show you the differences. So there are Medicaid funded programs, and on the left-hand side on this slide, you'll see what are considered entitlement services. What that means is that these are programs that and services that hopefully require less of a wait. And when I say less of a wait, it could depend on your area. On the right-hand side are non-entitlement services. So those are those waiver programs that we're going to be talking about. programs like MDCP, HCS, CLASS, DBMD, and Texas Home Living. So you'll see on the right-hand side where I have put long-term services and supports, most of these waivers, the wait list is 15 to 20 years long. Hope you're sitting down when I just said that. But that is how long it takes for your name to come to the top for your loved one. Those are the waiver services. What's on the left, those are services that our families are entitled to. You may have to wait for a service coordinator, but these are services that generally come a little more easily and with less of a wait time. So what we're showing you here, and you'll see at the bottom of the slide, is the link of that slide that you see. This is a really great overview of all of the different waiver programs, of the entitlement programs. So you'll see that, for
No, this is the
example,
waivers, Judy.
um,
These are the
oh, I'm
waivers.
sorry. I saw one side. I have to look at two different screens. My apologies. Yes, this is for the waiver programs. So you'll see that you have in the middle CLASS, which stands for Community Living Assistance and Support Services, CLASS for short. This is one of the waivers that takes about 15 years for your loved one to come to the top. You'll see deaf, blind, multiple disabilities. If you are on this call and you have a loved one with a disability and you have never heard of any of these programs, we encourage you, and we're going to be going through this, to call the phone numbers that we're going to be providing to add your loved one to the list. What you would do is you would call your local authority for a couple of the waivers, and then there's a number that we're going to be providing for the CLASS list. But this link at the bottom shows you a comparison of all of the different Medicaid waivers, and you can see what it is that they have to offer. Leslie, I'm going to have you go from here.
Okay. So on these waiver comparison charts that we are providing the link to, like on the last page was for the waivers, you'll see that it's in columns and it's several pages long, but it's an awesome tool to use because at some point, a lot of people may have a waiver and then come up on another waiver, and you're going to have to compare and decide which one you want to stay on. So you can be on multiple wait lists at the same time, but once you have a waiver, you can only be on one waiver at a time, but then you can choose to switch. But once you switch, you're gonna be stuck with that one. So you want to make a very good choice because then you would have to go back to the bottom of the waiting list for the one you gave up. So just keep that in the mind. So the last slide was the different waivers. This is a slide that compares some of the entitlement services. And the big one that we're going to be talking about a little bit later is called Community First Choice, or CFC. And that is the personal assistance services and habilitation attendant care that comes with all the waivers. But if you're on the waiting list and don't have a waiver yet and have Medicaid, you can go ahead and get Community First Choice. But we'll talk about that a little bit later. So these are two different comparison charts. Next slide.
Oh, whoops. Sorry about that. Let me go back to. Ah, there we go. Can you see it now?
Yes, and this one
Okay,
I think has
it does. Yep.
okay. So MDCP, which is the Medically Dependent Children's Program, um, deaf, blind, multiple disabilities waiver, and then the class waiver. Those 3 are going to be through Health and Human Services. So what that means is you don't go through the LITA, like Texana or the Harris Center. Um, for these waivers, the number to call to get on the wait list is at the bottom of this slide. You know, if you don't know which waiver to wait list to get on as many as possible that sound like they might fit your child. So if your child is not deaf and blind or have multiple disabilities, you don't need to get up on that wait list. But if your child, for MDCP, that's going to be for a child that has a lot of medical needs. It used to be a lot easier to get on MDCP if your child even took medicine for a seizure. A long time ago, they could get on MDCP, but now they've really tightened it up. Your child must need nursing care where just an attendant wouldn't be appropriate. But I would encourage you, if there's any doubt, to get on the waiting list, because once your name comes up, they're going to do an assessment and let you know whether your child or adult qualifies. So err on the side of caution. Anything that looks like your child may qualify for, go ahead and get on that interest list. And
Keep in
there's the
mind too,
number.
keep in mind too, that sometimes if you call the 877 number and leave a message and you don't hear back, please call them again. I can't stress, and Leslie can't stress enough, the importance of your name being on these lists because the wait list is so long.
Yeah, and another thing, a lot of times people don't put their child on the interest list because they hear the word Medicaid waiver and they think, oh, Medicaid, we're not going to qualify for Medicaid. But it waives that if you have a child, if the child comes to the top of the list, Medicaid comes with the waiver. So, and they only look at the child's income, not the family's income, except for Texas Home Living. So, I have friends that didn't put their child on the waiting list, and then they're all of a sudden they're teenagers or adults, and now they're waiting 15 years or more, where I put my son on the interest list when he was, as soon as I found out about it at 5, because at first I thought, oh, we're not going to qualify for Medicaid, so I didn't do it earlier. And back then we waited about 9 or 10 years to come to the top of the class list. Next slide. The Star Plus Home and Community-Based Services waiver, this is a waiver for adults. If your child has MDCP and once they turn 21, they're gonna roll into this waiver if they have a lot of nursing needs. And they haven't come up on a different waiver that you chose instead. So, and another thing is if your child turns 21 and they don't have a waiver at all yet, this waiver could be a possibility for them at that time without a long wait. Not everybody's going to qualify for it. I'd say go for it. And it goes through your MCO. They're the ones that are going to start the process. So your managed care organization is who, when you get SSI, and then in Texas, when you get SSI, you also get Medicaid. Once you get Medicaid, they're going to have you choose a managed care organization to run your Medicaid through. So for instance, when my son Cameron got Medicaid, we chose United Healthcare, and that's our MCO. So his Medicaid is United Healthcare Community Plan Star Plus, because he's an adult. The Star Plus waiver is the long-term care portion, the waiver part of the Star Plus Medicaid, but not everybody gets that. He's on the class waiver, and Star Plus really wouldn't be the most appropriate waiver for him. So we stayed with class, just to give you an example. But you do have to be 21 to get on the waiting list, and you cannot have any other waiver. So if you have another waiver, like if my son Cameron has class, if we wanted to switch to the Star Plus waiver, we could, but we'd have to drop the class waiver. So you can't have more than one waiver at a time. Next slide. And another thing I want to say about that, especially if you have an adult and you have Medicaid, your adult has SSI and Medicaid, the managed care organizations are supposed to be talking to the family and seeing what disabilities and what needs they have and doing assessments for the Star Plus waiver if they don't already have a waiver. But that's really not what we see.
It's
There's a
not
lot of
happening. Yeah,
Yeah, there's a lot of turnover in for service coordinators, and a lot of them don't have a lot of training. So parents have to ask for these things. Um, and if you're talking to your child's service coordinator and they don't know what the Star Plus Home and Community-Based Services waiver, or if they don't know what CFC, Community First Choice is, ask to speak to their supervisor. You have to be an advocate for your child to get these services. So they're not always going to ask. Sometimes they do. There are some very good service coordinators. So, but you have to ask. So the other waivers, like HCS, the Home and Community-Based Services waiver, Texas Home Living, um, most people think HCS is the king of all waivers because it does have the highest budget limit, and it does have residential placement. And what I see on the Facebook groups for special needs is that everybody thinks their waiver is the best for, because that's what they have and they don't know much about the other waivers. But it's really important to compare. My son came up on the class waiver first. And of course, we accepted it. Don't ever want to turn anything down. And then when he came up on the HCS waiver to the top of the list, we had to really compare the waivers, the waiver services, because each waiver has different services, figure out which one is going to work best for your family now and in the future when we're no longer here. So it's really important to compare, ask a lot of questions, do a lot of a deep dive on each waiver so you make the right choice. Because, if you give up one waiver and the new waiver doesn't work out so great, you're looking at a long wait to get back on the one you were on. HCS and Texas Home Living go through your local IDD authority, like Texana, the Harris Center. Judy, name a couple of others.
yeah, there's Tri-County Behavioral Health, there's the Gulf Coast Center. So we've listed there who you should call if you're in one of those counties listed on the slide. But if you are outside of one of these four counties, what you want to do is go to this link at the bottom and it will tell you which local authority you contact. And all you're going to do is call them and say, I'm the parent or I'm the caregiver for so and so. I need to add them to the HCS and Texas Home Interest list. And then you wait and you wait. If you happen to move to another county within Texas, you don't lose your place in line. You just have to notify that new local authority so they can do a transfer. So make sure if you move that you let them know which county you are currently living in.
Yeah, if they can't get a hold of you, they check with families every couple of years to see if you want to stay on the interest list. And if they can't get a hold of you, they'll remove the name from the interest list. So some parents call once a year just to see where they're at on the list. They can kind of tell you, like if you call the HCS, if you call the Harris Center, for instance, and ask where your child is on the list, they're going to say, yeah, this year we're working on taking people off that were put on year 2007. So that kind of gives you an idea how long you have to wait. And, this legislative session, they didn't approve any new slots for the next 2 years. So the only way somebody's going to get a slot is if somebody gives their waiver up, moves, passes away, or something like that. So you definitely, another way you can check your spot on the waiver list. I haven't done it myself, but supposedly you can go to yourtexasbenefits.com and set up an account for your child, and that's a Medicaid site, but you can track it there also. Next slide. So each waiver has criteria to be eligible for the waiver. On HCS and Texas Home Living and CFC, a person could have just an intellectual disability, and we're putting the IQ scores there because they really do stick to that. They could have autism and an intellectual disability, and their IQ could be a little bit higher, or they could have a related condition, and a related condition is considered something like cerebral palsy, a chromosomal disorder, Down syndrome, or something else, and have an intellectual disability that can be a little bit higher. So that's the main criteria for HCS and Texas Home Living. Next slide.
Did you want to read that note at the bottom?
Oh, yeah. If you have a child or an adult that has a related condition and maybe their IQ is a little bit higher, but they have extreme deficits in adaptive behavior, they could possibly qualify. So go through the assessment. The first thing that's going to happen when you come to the top of the list for HCS and Texas Home Living is your local authority, like the Harris Center or Texana. They're going to do a DID, a determination of intellectual disability, and they're going to do a full assessment to determine if they move forward with that person and if they qualify for the waiver. But if in doubt, go for it. Doesn't hurt to get the assessment. And we kind of talked about related condition. A related condition is a severe and chronic disability. And this just gives some examples. It has to have manifested before the person reaches age 22, and it's likely to continue indefinitely. Next slide. And we didn't really, I can't remember, Judy, if we have a slide about qualifying for class, but if we don't come to that, I can explain that too.
Sure.
So a related condition is a severe and chronic disability that, here's some of the examples, like the person can't take care of themselves, maybe they don't use or understand language, and have learning problems. They could have mobility problems, aren't able to self-direct, and they, just don't have capacity for complete independent living. Next slide. And then I kind of mentioned that the LIDA is going to do the determination of intellectual disability. So it's really important that people save all their records. They're not necessarily going to just take your word for it. You want to have all your records from doctors, from the school, previous test, evidence that they had an intellectual disability before age 18. And sometimes, they will do the IQ test. When Cameron was little, he had a DID for some other general revenue services at the Harris Center, and they did a DID, but when they come up on a waiver, it has to be within the last 5 years, or they'll do a new determination of disability, of ID, of intellectual disability. So sometimes people are kind of confused by that because generally people that have an intellectual disability, it doesn't change, but they're going to do it if there wasn't one completed within the last 5 years. So when they do the assessment for HCS in Texas Home Living, they're going to determine the person's level of need. The level of need is really important to know. Um, and if you'll notice, for some reason, they didn't put them in the number order, but intermediate, limited, extensive, pervasive, and pervasive plus. And that is really important because that is gonna determine, pay rates for certain things, especially like if you're gonna do host home where they live in your home and you get paid a daily rate to care for them. Um, we'll talk about all the hopefully, we'll have time to talk about the different options on HCS, for residential, but make sure you know your level of need. You have to ask. I would try to get a copy of everything, um, because you don't wanna you're gonna have to choose an agency, and not all agencies, pay the same rate, and if you know the rates and your child's level of need, you'll be able to negotiate that. You know, there are limits, of course, but, like, some don't pay the full rate. Next slide. This is another part of that comparison chart that we showed you for the waivers and for the entitlement services. And it's further down, but it's going to tell you, as you see across the top, are the different types of waivers. And then there's going to be a long list of waiver services, and not every waiver has the same services, but this kind of gives you a quick rundown of which waivers have which services. So that's
For
another.
example, oh, I'm sorry.
Go ahead, Judy.
Yeah. So for example, my son is on the HCS waiver. So you can see the second column from the right, anything that has yes in it is what he receives. And what helps for him is that, he's in a group home. They provide transportation to his job. He works part-time. He goes to a day program on Mondays and Fridays. They provide transportation to that. So as Leslie mentioned, it wouldn't work well for me for my son to have class, whereas for her family, class works really well. The important takeaways, because we know this is a lot of information, is to make sure that your loved one is signed up on the lists. That's the most important thing. If you move, to notify them. And if your loved one is not on a Medicaid waiver like HCS or MDCP or class, we're going to be talking about community first choice. We always want to make sure that our families are getting all of the supports possible.
Yeah, you can go to the next slide, Judy.
Sure.
And really, it's up to you to really do your homework. You can find everything you want. All the provider manuals are online. A lot of times, different agencies will tell you information that might not be correct. They're not going to tell you about every service on your waiver sometimes, or how you can do it differently to make it work for your family. For instance, Cameron's on class, and we were doing consumer directed services versus using a direct service agency, which meant that I was the employer, and that was working out great because he was under 18, so we couldn't be paid to be his caregiver. And on consumer directed services, you can pay a little bit more. But then during COVID, nobody was coming. So then I switched to direct service agency side, where I could be the paid caregiver because then he was an adult. And so I work for the direct service agency. But luckily, the agency I use said, yeah, you can keep his respite care on the CDS side, and that way you can use out-of-home respite for camps, and you can pay your respite people a little bit more. And right now, if you use the direct service agency side, they really have a hard time finding employees for you anyway. So most parents are finding their own employees. So you might as well do consumer directed services and pay them a little more if you're not going to be the caregiver. Um, so this just talks about the difference. I'm not going to read all of it, but it talks about the difference in consumer directed services and direct service agency. Not all services can go under consumer directed services. Some parents are not going to want to do consumer directed services because that means you're the employer and you're responsible for finding, hiring, training, firing, keeping up with their timesheets and all of that. And some parents don't want to do that. That's why you're allowed to pay a little bit more. But if you do choose consumer directed services, you have to choose a financial management agency service, and they do all your payroll and taxes, and they also train you how to do everything. So, um, choosing your provider, your direct service agency, your FMSA, they call it provider agency for HCS and Texas Home Living, is very important. They're just going to give you a big long list to pick from. You need to do your homework. You need to talk to other parents, find out which ones are doing a good job. Some don't pay on time. Some have horrible group homes, some have great group homes. Um, it's just really important to choose a good agency. So definitely, you're going to always get the best information from other parents. So if you're not on any of the Facebook groups for special needs that are private, you should join because you're going to get a lot of help from other parents who've already been there and from different nonprofits like Family to Family, the
Oops.
ARC, um, and all of
So
that.
in my case, I was the employer. I wanted to have that control. I hired the person who worked with my son, and it was worth it to me. Yes, doing all the timesheets, making sure they got paid. I had an agency that I selected that took care of sending out the checks and doing the taxes and everything. It was more work, but it was worth it to me because I wanted to have her for my son. And that's an individual choice that each family has to make.
Yes, and I know people are worried because I know a lot of people that have HCS and Texas Home Living in Fort Bend and were using Texana as their provider agency, and they stopped doing that. They're like, "Oh no, what am I going to do?" Well, you find a new provider and they're like, "Yeah, but I want to keep my caregiver." Well, they can just go and sign up because let me tell you, all of the agencies are looking for employees. So you can bring your caregiver with you. Um, so just ask a lot of questions. Another thing is if you're doing HCS or Texas Home Living, your service coordinator or case manager is going to be through your LITA, like Texana or the Hair Center or Tri-County or whatever. On class, you're going to have to choose a case management agency, and that's another very important um, choice because they're not all created equally. But that's one of the first things they're going to have you do when you come up to the top of the waiver list. You're going to have to choose a provider agency. Unfortunately, they call things different on all the different waivers, which makes it very confusing. So on HCS, you're going to have to choose a provider agency. Um, and if the provider agency you choose is really, and you can change. It's not a big deal to change, like Judy changed for her
Mhm.
son because you may change provider agencies because maybe you were doing pass-hab and then you decided for them to go into a group home. Then you're going to choose a provider agency that has good group homes. On class, you're going to have to choose a case management agency. And then you're also going to have to choose they call them direct service agency, which is the same as a provider agency. And then if you're doing consumer directed services on any of the waivers, you're also going to have to choose an FMSA, a financial management agency, to do your payroll and taxes. And I know this sounds like a lot and very
Mhm.
overwhelming, but if you choose a good agency, like for us, we chose Touch a Class. They do business as Touch a Class, but their name on the sheet to choose is called Caregivers Home Health. I chose them because I had a friend who had already used them and had a good experience, and they were wonderful at training me how to do the consumer directed services, and they pay on time. They know how to they were the ones that told me I could split the respite off to the CDS side and I could work for them to be Cameron's caregiver. And so that's why your agencies really matter. But if you get a bad agency, you can change. We had one um, case management agency, and they were great until they lost some of their employees and they didn't really train their new employees well, and they were sending in paperwork that wasn't correct to the state because any changes have to be approved by the state. And that's another thing. You're going to have a yearly budget meeting for any of these waivers. It's your responsibility before you sign off to check everything. I was not checking everything because I'd never had a problem, but when we got that new case management manager, she didn't know what she was doing. Check your numbers, make sure they add everything right and multiply things right. Make sure they have all the services you talked. Don't sign off on something if you don't know what you're signing off on. If you see something left off, because that goes to the state and it sits on their desk and finally gets approved. Well, if they mess something up, it's got to go back to the state. So it's really important to pick good agencies. Um, okay, that's enough about CDS. If somebody needs to know more about that, just let me know. One thing we talk about is, so Medicaid health insurance is the door to all long-term care services. So you always want to keep your person Medicaid eligible. A lot of people have their adult children on their private health insurance, either through an employer or sometimes another way. And generally speaking, in Texas, they can stay on your private health insurance till age 26. But I would encourage you to check with the company's Health and Human Services. We were able to keep Cameron on my husband's health insurance indefinitely as long as he worked there. And Medicaid is always the payer of last resort. So when Cameron was on his father's insurance and had the class waiver and Medicaid health insurance, my husband's insurance paid first. If the doctor accepted Medicaid, Medicaid would pick up the difference. Um, and then also know that the waiver is very last resort. So if nobody pays for something, a lot of times you can put it in your waiver budget. So for instance, as an adult, Medicaid doesn't really have full dental benefits. So we're able to put dental benefits in his budget under adaptive aids, and it pays for his dental. Because my husband's now retired, so we don't have the other insurance. So definitely, if you can, see if they
Yeah,
can stay.
you just want to contact the Human Resources Department of whoever insurance you want there to be on. And generally, if you write a letter, they're allowed to stay on after 26.
Yeah, your doctor may have to provide a note or something, but Of course, that insurance is going to be very good because you can have a lot more providers to pick from. Some of Cameron's doctors accepted both Medicaid and my husband's insurance. Some only accepted my husband's insurance. So just something to talk about. Next slide. So we talked about how you have to choose a managed care organization once the person gets Medicaid, and this is just a little map that shows which managed care organizations are in different areas of Texas. You usually have about 2 or 3 choices to choose from. I recommend that you talk to your doctors that you want to keep and say, okay, do you take United Healthcare Community Plan? Do you take Community Health Choice, or do you take Molina? And pick the one that um, pick the one that takes the most of your doctors that you already have if you want to keep those doctors. And then you'd have to find new doctors. Right now, Cameron only has Medicaid because my husband retired and we're in that 2-year gap period before he becomes eligible for Medicare because I started drawing my own Social Security. And that's a whole nother topic. But if you want to know about that, just let me know. Next slide.
And real quick, when it comes to choosing a plan, make sure that you contact the doctor's office and not the managed care organization. You want to hear it from the horse's mouth. You want to hear it from the doctor's office that yes, they do accept a particular health insurance plan. Don't just go by the website because not everybody's updating it correctly. And the person you talk to at WellPoint or Community Health Choice, they may have something that's outdated. Always check with the doctor first.
Yes, that's very important. I remember when Cameron first got Medicaid and I started calling doctors on their website and even called the service coordinator, and they gave me a list of doctors that were supposedly going to accept the Medicaid. I spent 2 whole days and they either said they weren't taking any new patients or they no longer take Medicaid. So that's another thing, by word of mouth from other parents, you're going to find good there are some good Medicaid doctors out there. You just talk to other parents, network on some of those Facebook groups that are those private special needs Facebook groups. So what do you do if you're on the wait list for the waiver and you don't have a waiver yet, but you do have Medicaid? A lot of times this happens because the child has turned 18. When they turn 18, you apply for SSI. And then once you're approved for SSI, you get Medicaid. You choose your managed care organization. And due to the Affordable Care Act, there is now Community First Choice, which is non-waiver CFC. So with each waiver, you get CFC, which is the federally funded part of the waiver for personal assistance, habilitation, attendant care, to help them with their activities of daily living. Now, due to the Affordable Care Act, if you're not on a waiver yet, you can get non-waiver CFC through your Medicaid. And they're not always going to tell you about that, but you would call your service coordinator for your MCO and say, I'd like my adult child. And they could be a child and have Medicaid and get CFC too. So you want to have them assess for CFC, Community First Choice. If they don't know what that is, ask to speak to a supervisor, because they get it started and then your LIDA steps in and does a lot of the assessments. If you're not getting anywhere with your service coordinator and your managed care organization, you can always call your LIDA and let them know, hey, we're trying to get non-waiver CFC. The managed care organization acts like they don't know what they're talking about, and you can get them involved. And so you're only going to get that PASS-HAB piece, but that could be very important. If they're 18, you can work the hours and then you could turn around and use that money to pay for other services they need, like daycare, because you don't have a waiver yet to pay for daycare. Um, you could use it. Some single parents need that's the only job they can really have, so maybe they need to work those hours, just to support the family. Um, they're gonna do the same type of assessment the LIDA is, and, it's to help with their activities of daily living.
So for
Yep.
example, when I had community first choice for my son, uh, we were working on lots of different skills. Even though he's capable in many ways, there's lots of things that he needed guidance on. So we allowed for maybe 30 minutes a week for one task, a half hour for preparing simple meals, um, helping him learn how to do laundry. So things like that. So even though Community First Choice is an entitlement program, you still may have to wait several months from your local authority to get that service coordinator. And that service coordinator is coming up and working with you on a plan along with the managed care organization. So the three people have to come together: the family, the managed care organization, and the service coordinator. And sometimes you have to keep calling to make sure that everyone's doing their part.
Yeah, and just think about activities of daily living as everything that your loved one would do on their own if they didn't have a disability, like bathing, dressing, eating, grocery shopping, preparing food, whatever, because they're going to go through a whole list, and you want to be brutally honest about what they can and can't do, because that's going to determine the number of hours you get for CFC. Um, You'll see on there number 2, CFC emergency response. There are some people that they can live on their own with support. So if someone, let's say they receive CFC during the day hours, like maybe help them get dressed for their job, things like that, help them grocery shop, help them do their bank account. Maybe overnight they would have emergency response services. So that's what that is. Also, CFC support management, and that is just to help you understand how to use your CFC hours and give you some support in that area. So
And we've
that's
listed,
really important to know about CFC. A lot of people don't know about it. They're like, "Oh, I've been on the waiting list for the Medicaid waiver, and I still have several years to go. This is horrible." Well, get CFC. It's a Band-Aid, but it's
it is
better
a
than
Band-Aid.
nothing.
It's better than nothing. And we've put links at the bottom of the slides so that you can always get more information because we know this is a lot.
Yeah. This just talks more about activities of daily living and habilitation. Habilitation is basically things that you're still trying to help them be more independent. Of course, they kind of go together, but they call them pass and have. Um, so acquisition and maintenance of skills to help them be more independent. But that's what PASSHAB is. Personal assistance is more anything you remind them to do, help them do, or do for them that they can't do on their own and may never do on their own. Next slide. And we kind of talked about that, so you can go to the next slide. This just kind of helps you understand how you're supposed to get CFC, non-waiver CFC. Um, you contact your managed care organization and request CFC PassHab, then they'll contact the local authority and you may have to wait, like Judy said, wait for a service coordinator, wait to get the determination of intellectual disability and the level of care assessment. And then, of course, it goes to the state to be approved. And if approved, then they do a more in-depth functional assessment, and then they determine the number of hours and get you all set up. Next slide.
So yeah, these are just resources that we've listed on this slide and the next slide. We know that we went through a lot of information, and these are just various credible resources, a lot through the Health and Human Services website. And you have to access that site, and then it brings you into the next link, and then the next link, and then you choose which waiver you have questions on. But these two slides, you can see they're all Health and Human Services um, websites. And you have to really compare what waiver you think is going to be best for your child. And if you're not sure, ask questions. Please make sure that you use the QR code, or Christina, if you could copy and paste the website link.
Judy, are you
Uh,
gonna, I wanted
Yeah.
Judy to share her screen and show
Yes, let
you
me go
how
ahead and
to.
show that. Let me do this. Let me stop sharing.
Yeah, so we really want you to be able to look at the rate sheets for each waiver. The more information you have, the more services and the higher rates you can get. The rate sheets are a great way to see all the services on each waiver. And so we want to show you how to access those rate sheets. That would be important when you're comparing um, waivers. Like I had to compare the difference for Cameron between class and HCS. And so
So what you
Judy.
want to do, and the person who's Android, if you could please private message me and let me know what your name is so I can mark you present, I would appreciate it. But what you want to do here is, this is the Family to Family Network page. And what you're going to do is, under Getting Started, you're going to go to Resources. And this lists all resources that we have available for families. And what you can then do is go to Medicaid and long-term services. And what you're going to do from there is rates paid for each waiver. Leslie, do you want to, here, I'll click on that.
Yeah, so when you click on that rates paid for each waiver, it's going to take you to this website. And on the left-hand side is going to be the list of a- the Medicaid waivers and some other Medicaid services. So for instance, if you click on class like Judy's doing, then it takes you to this page and you scroll down to payment rate information and you click on that. And then you're going to have the rate sheet for class. And all the different services are going to be, there's a description on the left-hand side and what the pay rates are. And that's just important to know because, like I said, you may want to call, let's say you came up on class, you're calling different provider agencies to choose one. And let's say you said, how much can I pay a caregiver, or how much can I be paid to be the caregiver? And if they give you a really low rate, there is they can't give you lower than $10.60 an hour, but you'll see the ceiling, which of course they have to take out some taxes for the government too. But if they're giving you a really low ball rate, you may ask them, is that negotiable? Or you may say, yeah, I'm going to check with and see what the pay rate is at a different agency, because the rates can be very low. So you want to get the highest rate possible. And
They did just have an increase. I think it's now what, it's still very low.
yeah,
12 something. I think the legislature did increase it, but it's still really low. And you have to remember that they're taking care of your loved one. Someone can work more at Buc-ee's making $15 an hour with benefits and vacation pay. So these direct service providers and these caregivers, they do great work and they are not paid enough. So when
yeah.
you have them, you want them to get paid as much as possible.
And another thing too is like some agencies, they will pay time and a half. but other agencies for overtime, but other agencies say, "No, we don't pay time and a half. You have to if you have more than 40 hours a week of attendant care, you have to hire multiple people." So that's another thing. Another thing that I really wanted to go over, but you can always call me about some of the specifics. One thing that can be very confusing to people who are on the HCS waiver is there are several different residential options. So you can do host home where you're paid a daily rate to keep your loved one at home with you. But if you do host home, you don't get any respite care. You would pay for that out of the money you get paid for host home. You could do host home in somebody else's home. There are people that live in family homes with other families, and the family gets paid the host home rate plus, um, the individual would pay room and board out of their Social Security. You can live in a group home like Judy's son does. You could do PassHab, where you hire somebody to help them with their activities of daily living. That's what our, executive director does. Um, Another option would be, which is new to HCS, they made it permanent where you could also, under certain circumstances, there's lots of rules, you could be paid the hourly rate. So, for example, Cameron's on class, and when I figured out the hourly rate that I could be paid on class compared to the host home rate, which was the only available rate because on HCS, the rule was you couldn't live in the same home and be paid unless you did host home. Well, it was a much lower rate on HCS. And you lost your respite. And we use a lot of respite for Cameron to go to camps. We use out of home respite for him to go to camps in the summer. And then we have a couple of respite care people that care for him in our home if we're going somewhere that he's not going to go with us. So there's lots of different options. And a lot of times the agencies don't always understand the options. So um, definitely reach out, talk to people, choose a good case manager. The LITA, the Harris Center, anytime I have a question about something, you can talk to them, or you can also email HCS class. They all have policy websites. So if you send them a very specific question, like, can I do this? How can I do this? They will give you an answer too. So just because your agency says, no, you can't do that, some agencies might just not want to do that because it's a little more work on them. So just do some digging and try to do what works best for your family.
Do you all have any questions? I know we went over on time. My apologies. There was a lot of information, a lot of important information. You can always, email us questions. I know that it's a lot to absorb. Please make sure that you complete the survey. And I don't see any questions. That means your head is probably spinning.
Yeah, it's a
That's
lot, but,
okay.
like,
It
feel
is.
free to reach out to any of us with any specific questions, especially if your, loved one is on a waiver and you have a specific question, or if you just are so overwhelmed by all of this and we can, help you do it. Don't get overwhelmed, just do one thing at a time. The biggest thing is, like Judy said, is if your child's not on the waiting list, get them on the interest list now. And if your child already has Medicaid, reach out to your MCO and get started with the CFC, the Community First Choice.
Thank you all so much for joining us. We truly appreciate it. Have a great rest of the day.